From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
And welcome to Medical Forum on this nice, steamy, hot Saturday morning, Dr. Marr.
It's been a hot week, well over 100 almost every day.
Are you back in shape, working now?
Back in shape, back from Europe.
Good for you.
We had a nice time over there.
Well, we missed you.
Well, I appreciate it.
We missed you. It was like trying to do something that it takes two people to do, so I was doing the work for two.
But you can do it, Jeff. I've seen you do it before.
Well, thank you very much.
Last week you had Jeff Fall on, and
yeah.
Sounds like Toomey had a very successful race.
It was a great race. I appreciate Jeff Fall and Toomey not only supporting the show, but everything they do in the community. And they had the 5-miler.
Not 5K.
Not the 5K. The
5K is where I stop.
Yeah. No, the 5-yard.
5 yards. I start.
Right.
Okay.
Yeah, and I'll hand you the water and then you go finish it.
Absolutely.
But anyway, good to have you back, sir.
Thank you. Appreciate it.
And, today I'm very excited, and I think you are too, because our patients that we see so much are constantly asking us about insurance. And someone that I've dealt with personally in all my business, personal, home, auto, has been Bynum. And just a little bit, they're a staple of community here on Bynum, just down from us at your service as well on Wilson Hall Road. But we have Bynum Insurance here today. We have two representatives, Ms. Karen Schwartz, Ms. Sandy Wilson, who are going to inform us on so many different levels. So we don't want to debate and have too much time to take away from them. But little background for anyone just coming into Sumter. I know a lot of military people, and of course our range goes to Florence, little through Columbia, Manning, and such. But Bynum been with us since 1955, and Mr. Henry Bynum unfortunately just passed away. And one of the things we did on the last show was a little tribute to Pat Prost, Dr. Prost. But Henry Bynum, it doesn't get any better than him, and we miss him. But the Bynum tradition continues on, and we have two representatives here that echo that. So without further ado, I think what we'll do is introduce our guest today, Karen Schwartz, Sandy Wilson. Karen, why don't you give us a little background on yourself, how long you've been here in Sumter and with Bynum, and then we'll do the same with you, Sandy.
Okay? Sure, sounds good. Great. Right. Thanks, Jeff. I am Karen Schwartz, and I am a homegrown girl from Sumter, grew up here, went to Clemson, and back married and raising a family, and I've been with Bynum. It will be 20 years this fall. So it's been a long time, and I love what I do. I'm very fortunate to have a job that I enjoy, getting to help people. I work mostly with the health and life department, but with Bynum, a lot of people don't realize that we are a full-service agency. We can help people with their homes, their autos, life, health, and businesses with the business insurance, too. And as you mentioned, Jeff, we've been around for over 50 years, so we're located right on the corner of Wilson Hall Road and Westmark. People always recognize us because we've got the time and the temperature right outside. So we would love for any of your listeners to come by and see us anytime. We're glad to help them, and they can get a handful of candy from our candy jar.
Well, Karen, thank you so much. And Sandy, thank you coming in here on this little early. No, it's not that early, is it?
Well, not early for a weekday.
It is for Saturday.
But for Saturday, it might be.
Your tea time got backed up just a touch. But Sandy, tell us a little bit about yourself, please.
Well, I didn't know Karen had come 20 years ago. I'm coming up on 19 years in this fall.
Wow.
And so I guess I came about a year after Karen. My father was in the military. He was in the Air Force. So I've lived in Sumter most of my life, and that's how I got here. And have been with Bynum Insurance for, like I said, 19 years. And I work in the personal lines area, home, auto, renters insurance, and then, of course, the toys, boats, four-wheelers, golf carts, things like that. And Bynum Insurance is a great company to work for. I've enjoyed being there.
You know what? And I will give a little personal testimony on that as well. Our business, Reliable Medical Equipment, and at your service, and all my personal has been through Bynum. And fortunately, I've worked with Miss Kelly Pollock and Miss Karen Schwartz and Sandy, you and I as well. And it does not get any better. And every year, especially with health insurance, which we're going to talk about, Karen, a lot today, because I think a lot of our listeners and myself, and Dr. Marr included, we don't know a whole lot about what's going on out there. You know, we hear Obamacare, and then we see prices go up. And fortunately, what people need to understand is that you can have insurance and what an insurance agent does. And I might even ask you to kind of talk about why wouldn't somebody go direct to auto owners? And I'll give a personal reason. You guys go out and shop 3 or 4 different prices and always beat them. And that means so much to my businesses when you come in and say, I can save you money. And it makes my life easier. If you don't deal with Bynum, you're losing money. And I'm going to throw in one other one. Our last guest last week, Jeff Fall, we'd mentioned him, bragged about as we discussed that you would be on with Bynum this week, said no one worked harder for Timmy Hospital to save them money. So it's not just me at Reliable, Jeff, the same thing. But why do we deal with an agent, for example? Karen?
That's a great question. A lot of people don't realize that for health, you could get an individual policy direct or you can go through an agent. But the great thing with an agent is when you have a problem with a claim or an issue with the doctor, instead of you having to get on the phone and with the Obama policies having to call healthcare.gov, you can then pick up the phone and call me and I can handle that for you. So the rates are the same whether you go direct or through an agent. And like you mentioned, Jeff, with business insurance, the nice thing is for the groups that I do, their group health insurance, every year at their renewal, and it doesn't matter if it's a 2-man group or a 600-man group, we're going to quote it with all of our carriers and then find the best price and the best benefits for our customers. So I do that every year for my groups just to be able to provide them the best level of service.
You're nodding, Sandy. What do you want to add to that?
An advantage that I like for working with Bynum Insurance is we are an independent agency. We represent many companies. And so some agents only represent one company. And they're all good companies. But I think it's an advantage to work for an independent agency and have access to multiple companies. Not every company's going to be the best price for every individual. So we can look to all the different companies and look for the best price and the best coverage for that individual.
That is great. And you know what? Time flies. We're coming up on our first break. So happy to have you two here from Bynum Insurance. And Karen, as we go to our first break, give us your physical address, give us your direct line. Sandy, give us your direct line as well.
Sure. We're located at 1170 Wilson Hall Road, right on the corner of Wilson Hall Road and Westmark. Our office can be reached at 803-469-3030, and my direct line is 905-4547.
And Sandy, your direct line?
My direct line is 905-4520.
And we'll be back after and get into all the different insurances and all the different carriers you have. We want to thank At Your Service Home Care for always being around to sponsor us, and we'll be back after this first break.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto Owners will save you money on all of the insurance you already have. Now that's good policy. This is Sandy Wilson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine, and they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
This is Medical Forum, presented by At Your Service Home Care.
And we are back. We are with Bynum Insurance, Karen and Sandy, getting into our second segment. I also want to thank Toomey Hospital and all that they do, the Sumter Orthopedic. Go see Danny Ford, Dr. Ford, and Dr. Strobel and all them for all of your needs. Direct line up there, 803-774-7621. And Dr. Moore, we talked about this before when we knew that we were going to have Karen and Sandy on. And both of us being in the medical industry and insurances, we both had a ton of questions.
Yeah, I've experienced the Affordable Care Act from the physician side for a little over a year now. Well over a year now. We're probably about 18 months into this. And I see my end of it, but again, I have very little understanding of the benefits and how that works for individuals. So if we could talk a little bit about maybe explaining the difference between on-exchange and off-exchange. This is kind of a term that's new to me right now, and the essential benefits of that.
Sure, that's a great question. A lot of times we'll get calls and people will say, what is the difference between an on-the-exchange and off-the-exchange? There are 4 carriers that are representing individual products: Blue Cross Blue Shield, Blue Choice, Coventry, and Consumer's Choice. And
correct me if I'm wrong, those four carriers are state-specific, so each state may have different carriers. They may have more than 4 or less than 4. Is that correct?
That is correct.
So those are our 4 carriers for South Carolina.
That is correct. And if you are on the exchange, those are for the people that are qualifying for the tax credits due to their income. So the carriers are the same and the plans are the same. It's just on the exchange if you get a tax credit. It's off the exchange if you're not eligible for the tax credit. The on the exchange is based on their income. It's based on their poverty level. The guidelines between 100 and 400% are the people that qualify for the tax credits, which means the government's going to help pay part of their premium, which lowers their monthly cost for their health insurance.
So if you're saying off exchange, you mean that would be just a regular individual policy?
That is correct. It's still a same plan. It's just off the exchange where we can write it directly with that carrier, with Blue Cross or Consumer's Choice or Coventry. If it is on the exchange, then we have to go through healthcare.gov and help the individuals enroll, because those are the people based on their income that are going to be eligible. And one of the things that I mentioned earlier, the prices are the same. It doesn't matter if you do it on your own or if you go through an agent, but most people prefer to go through an agent to have somebody to assist them, not only in the enrollment, but later on if they have a problem with a claim or a benefit issue.
Well, and absolutely, I see this all the time with my patients. You know, they may have signed up on a website, and what is the recourse for them to settle a discrepancy in a bill, a problem when for instance, when we may send a patient to a specialist who is not in network or is out of network? Well, if they signed up on the web page, healthcare.org, then what's their recourse there to settle that discrepancy?
Right. That's a great question. One of the main things when I sit down to work with somebody is to find out who their doctors are, because that's been one of the biggest things with the new plans. Not all providers are participating in all of the networks. So you've really got to know what you're doing, because you could end up in a situation where your doctor or your specialist or even your hospital does not take your plan. So that's one of the first things that we do, is to get a list of their providers and then make sure that those providers do accept the coverage.
You know, one thing, Karen, just doing a little research before we came on, I went to Obamacare website, and the third paragraph says, and I quote, "The best thing to do to avoid exactly what you said, Dr. Marr, and confusion is to talk with a licensed health insurance professional who can help you." And I think what you're echoing here, Karen, is that it doesn't cost anything more.
That's right.
But to avoid some of the pitfalls that you've pointed out, this is coming straight from their website. Don't try to vector through this on your own. Let's talk to someone who does this for a living.
Right. Exactly. Exactly.
And one of the things I think that people have to understand, this is not something that you just can sign up for. I'll do it tomorrow. I'll do it the next day. There are time frames, and there can also be some penalties if we don't.
That's right.
We're kind of coming up on one of them, and I believe February of 2015 was a cutoff for 15.
Well,
for a while.
That's right.
Okay.
For right now, in fact, I had somebody call me earlier today and wanted an individual policy, and I had to explain to them that I'm sorry, it's not open enrollment. Open enrollment is November 1st through January 31st. So, again, starting in November 1st, we can start enrolling individuals then for a January 1st effective date. So they can start enrolling in November and December, but it would be January before it is effective. The only way somebody can apply for a plan right now is if they have a qualifying event. That would be if they were to get married or had a baby, or we have a lot of people that might have lost their benefits. Either they got laid off from their job or they were covered under their spouse and they no longer have the benefits. So for that person, that's a qualifying event, and we can sign them up within 60 days of that. It's called a special enrollment period. So for those people, they're okay.
Okay, let me ask you this. We deal with Medicaid so much in our line of business. I know it's not apples to oranges a little bit. But if someone had a procedure, say, in September, and then they applied for Medicaid, they might receive Medicaid in mid-October, late November, but it's retroactive back to an incident, say an amputation or a heart surgery. Does this care work that way too? So when you talk about I've been laid off, and that gives me kind of a special time where I can come in. It's not within the guidelines of, say, right, November 1st. Once I get that in 60 days, the procedures I might have had the 2 months prior to the 60 days, are they retroactive?
No, those procedures would not be covered, but there would not be pre-existing. Before Obamacare, you had pre-existing, and a lot of the carriers would not cover a pre-existing condition. But now with the Obamacare, the pre-existing conditions will be covered starting at that point, but they would not go back and do a claim that was prior.
Okay. And correct me if I'm wrong, Karen, pre-existing illnesses, the non-coverage for those has been eliminated across all healthcare plans based on the Affordable Care Act. Is that correct?
That is correct.
So no one has to worry about not having pre-existing illnesses covered from this point forward, no matter what their insurance policy is.
That's correct. Now the plans, they have to have what's known as the minimum essential benefits. Those are 10 benefits that all plans have to include. They vary from ambulatory, hospital, emergency services, prescriptions, mental health, and substance abuse. Those were some areas that a lot of plans didn't cover. Pediatric services, including oral and vision, and then preventative. All plans now cover preventative and wellness. So that's a huge plus for a lot of people who've maybe not gone and gotten a physical in years. They can now go get a preventative well care visit and it's covered at 100%.
Karen, I think that is a great way to segue into our next as we come up on a station break here. And we're here with Bynum Insurance. Give them a call at 469-3030. And we want to talk, one of the things we've always talked about, preventative medicine. So this will be a great segue into our second segment. Karen, we'll be right back.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports. WDXY 1240 AM and 105.9 FM.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto owners will save you money on all of the insurance you already have. Now that's good policy. This is Karen Schwartz with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
This is Medical Forum, presented by At Your Service Home Care.
Welcome back on this Saturday morning here with Dr. Marr, Karen Schwartz, Sandy Wilson from Bynum. Want to thank At Your Service Home Care, your concierge steward, your guide to all home care and beyond on 1250 Wilson Hall Road, or visit them on the web at www.ays and then a / homecare.com. When we left, Karen, we were talking about something that on almost all of our shows, when we've dealt with medical and now with insurance, preventative medicine. Last week, Jeff all talked about the Smart Beat at Toomey Hospital. Dr. Louder and you at Colonial Family, Chris, have always talked about if we can locate the problem and the source ahead of time. And Karen, now, is that kind of what, if there's a great side to Obamacare, I know it gets, good side, bad side, but we're looking at no pre-existing and trying to prevent problems down the road?
Right. Those are two of the great things. There's no pre-existing, and the preventative wellness is covered. Also, there's no annual limits and no lifetime maxes. It used to be that you would have annual limits on certain procedures, and those are no longer applying.
What's an example of that? I can't say the word.
Well, I think you're talking about lifetime limits. One of the things we always talk about is our stem cell transplants and things like that. I mean, these are multi-million-dollar procedures, and I think there was a politician several years ago whose spouse came down with some sort of myeloma, needed a transplant, bone marrow transplant, and I think when he was surprised when his medical bills exceeded $2.5 million, which out of the pocket it used to be $2 million, I believe.
Right.
Is that correct?
Right.
And a procedure like that exceeded that amount, and that's where a lot of this legislation came from, if I'm correct.
You're right.
Yeah.
That's right.
We had talked a little bit about, you had mentioned about tax credits and qualification for those. Could you tell me a little more about that?
Sure. Some people, based on their household income, will qualify for what's known as a tax credit. This means that their premium will be less than it would have been if they did not qualify. We've been able to get a lot of our customers tax credits based on that. The tax credits can vary. It is based on your household income. For example, a household of one, if their income falls in the bracket of at least $11,670, not to exceed $46,680. So if it falls in that bracket, they will qualify for this tax credit. A family of four, as long as their income doesn't exceed $95,400, they would qualify, which the majority of households do qualify.
Those are very generous brackets.
Absolutely.
I mean,
No,
I think more
tax-
people will qualify than they think they will.
Tax credit, is that something that let's just take a $500 a month for easy math policy?
Sure.
And let's say that you said, "Hey, we were able to get you to $250." Is my cost $250, or is it $500? But I have $250 deductible on my tax return.
No, you would pay the $250. So
Okay.
you get to pay the lesser amount, and that's what you would owe each month to whichever carrier you signed up for.
And Karen, I have a very close friend, and I'm going to talk on a personal basis here that what Bynum did for this gentleman. This gentleman had stage 4 cancer, came in, had no insurance. Went, saw Karen. Karen, you worked with one of your colleagues, Lauren Barkley, on this, and it just blows my mind what you're able to do. You were able to get him, almost the example that you talked about, a policy that allowed him to see a physician here in town, oncologist, allowed him to get a surgery at Duke, allowed him to live. He stage 4, they went in, they removed his entire esophagus. This is how terminal the cancer was. And you were able to, and I'm not at all being dramatic. You guys saved his life, because if he couldn't get this type of insurance, not that you see this every day, but this is a true story, and this is what you're capable of doing. And there are insurance coverages out there that make it economical, and you still can qualify. And I think a lot of people would think, going back on what we talked about with pre-existing.
Right.
I'm 50, I have cancer. No one's going to touch me with a 10-foot pole. Not true.
That's exactly right. And that's a great story. You're right. Lauren assisted and got him the coverage that he needed. It used to be before the Obamacare, I'd have people call in that had diabetes. There was not a single carrier in the state of South Carolina for an individual policy that could write diabetes. And that's just a small example. That's not cancer or anything major. So that is a nice benefit with the Affordable Care Act, that for individuals there is no longer any type of pre-existing. And for the people that qualify for the tax credit, and those that qualify, they fall within the 100 to 400% of the federal poverty level. So the government sets the guidelines. It's not South Carolina picking and choosing who gets it. It's set by the government as to who qualifies for the tax credits.
Well, on that same line, not changing subjects too far, the Medicare supplements, the Part D, the prescriptions.
Right.
Give us a little information on that. So people listening in that might have, as you mentioned, high blood pressure or diabetes and need prescription drugs.
Right.
That's where they can come also see Bynum.
Right. The Medicare would be for individuals that are over 65. So what we've been talking about up to this point are for the individuals under 65. But over 65, we've got the Medicare supplements. And as you mentioned, the Part D is the prescription drug coverage. So when you turn 65, you need to have both a Medicare supplement that a lot of times people call it a Medigap policy. It fills in the gaps that Medicare doesn't pay for. And then you also need the prescription drug plan to help pay for your drugs.
And there's also an open enrollment for that.
That's correct. The open enrollment for Medicare prescription drug runs every year from October 15th through December 7th. So each year you can switch plans from one prescription drug to another. I always recommend for people with the Medicare supplement, there's not an open enrollment for that. So when you initially sign up, you want to make sure that you go with a good carrier, because later on if you develop a health problem and you've got a carrier that's not very good and it's not paying what they should be, I hate to say you'd probably be stuck, because in order to switch, you have to fill out an application and go back through underwriting. But for the prescription drug, there is open enrollment every year.
Okay.
Karen, back to the Affordable Care Act, can we talk a little bit about the fees and the fees associated with getting
Sure.
the an ACA policy.
Right.
And then there's also fees and penalties associated with not having
That's right.
Affordable Care Act.
That's right.
Let's talk a little bit about that.
Okay. The fee for those that just say, I don't want health insurance, I just would rather pay the fee. Well, for the first year, for 2014, it wasn't so bad. It was 1% of your income or $95, whichever is greater. So a lot of people just said, I'll pay $95 and not have health insurance. But each year it gets a little bit stiffer. For 2015, it was 2% of your yearly household income or $325 per person. For children under 18, it's $162.50. For 2016, it's going to increase. Instead of 2%, it'll be 2.5% of your household income or $695 per person. So the penalty is getting greater. A lot of people the first year didn't even realize it because they didn't know how they were going to have to pay this fee and, how the penalty. The way that they will take that is when you file your income tax return. So for the
Karen,
year you don't have
hold that
coverage.
one, because I don't want to go long, and that's so important to people out there. We're going to have to take a quick station break, and we'll come back right after that.
Back with more on Medical Forum, presented by At Your Service Home Care.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and a voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all your insurance needs 24/7. Now that's a good policy. This is Ed Bynum with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and to have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
And we're back with Medical Forum, brought to you today by Bynum Insurance and At Your Service Home Care. You can contact At Your Service Home Care at 607-9677. And Bynum
they're right beside almost each other.
They are right
so
by.
So maybe you can stop by and see them both.
See them both right on Wilson Hall Road.
On Wilson Hall Road, 1170, Karen?
That's right, 1170.
And we're 1150, I believe. So stop by and see. Karen, I had to cut you off, and I think in a very, very good point. If you could follow up that last statement, because I got to get to Sandy, because I got a 16-year-old and a 15-year-old. They're probably going to cost me an arm and a leg on car and insurance.
Right.
So I need to know about this.
Sure. Well, we were discussing the penalties for not having insurance, and just wanted to make sure that your listeners realize that if they don't have insurance, there will be a penalty involved, and it's taken out through your income tax for the year that you don't have coverage. And if you go part of the year, As long as it's less than 2 months, you're okay. But if it's more than that, you will pay at least a partial penalty.
Gotcha. Wow. We've learned a lot. Sandy, thank you for coming too. Karen, great information. And I want to have you back on because we have so many businesses out there that need to understand the penalties. Business, I know some key numbers between having 40 employees or 30 hours, and we'll talk about all that with insurance. Sandy, thank you for coming here this morning.
Good to be here.
Again, we got a little introduction from you when we started. At Bynum, your expertise falls into
personal insurance,
which entails
most everyone, once they get 18, 21, or whatever, most everyone needs auto insurance and some type of homeowners insurance, whether it's homeowners or renters insurance. So I work in the personal lines department, and we help people with homeowners, auto, and as I mentioned when we started out, the toys, four-wheelers, boats, golf carts, items like that.
Yeah, I live very close to a golf course. So if I can, this is a personal. How old do you have to be to drive a golf cart? And do you see that a lot, that people come in to get insurance on? Because I see them all the time going through neighborhoods, and I see kids that look like they're a little young. My understanding, 16 years old, do you still have to have a driver's license if you were riding a golf cart? How does that work?
That's really a DMV question, but I think
I tricked you.
I think it is correct that you need to have a driver's license to be able to drive a golf cart. But, it's so important to have insurance for those golf carts. One thing, a lot of people think that their homeowner's insurance is going to cover the golf cart in some way, or their auto. Homeowners insurance, except for one or two companies, majority of companies will not cover it in any way. And so if they call and their golf cart was stolen from their garage, there's no coverage unless they've added coverage. And then more importantly is the liability issue. Because with a golf cart, there's X number of dollars that you might lose. You might, whatever the cost is, $2,500, $5,000, whatever that property damage is. Mm-hmm. But with liability, you don't know what that entails. If there was an example of someone, children out driving a golf cart, and they ran over a baby carriage with a child, and they were hurt, or just kids out, and they let maybe the daughter is very experienced and understands how to drive the golf cart, but then the friends beg and ask, and she lets them drive, and they aren't as experienced, and they might run into a car or bicycle or something.
Or tip it over. There's no seat belts involved.
That's right. And then the other children are injured. And so liability is really the major part, so important for insurance.
Sandy, that's such a good point. I have a boat, and I drive my boat, and I carry, obviously, lots of insurance on it, liability insurance, but I'm never worried about damaging my boat because all the boats around me are more expensive than mine. I'm worried about, and if anyone's ever seen me drive a boat,
you don't want to break your oars.
That I should have the highest limits. But it's the things around you that we have to be worried about. If a golf cart hits an expensive car, then that's where the liability insurance kicks in, correct?
That's right. I think most people, from what I've found with conversations with most people, is that they are just like I was before I became an insurance agent. I'm the oldest person in this room, and most of my life I did not work in insurance. And when I had insurance but was not an agent, I thought, I have insurance. I'm just fine. No matter what happens, I'll be just fine. But that's because I was thinking of just damage to my car. Well, fortunately, I never had an accident, so I was fine. But most people, I have no idea. Before I became an agent, I have no idea what my liability limits were. And I find that most people don't know what their liability limits are and how important it is and exactly how they work.
Well, I have my insurance through Bynum, my home insurance, and you've taught me that. And it's not that much more expensive. So right. I think where people, when you're looking at cutting dimes and nickels, this is not the place to do it. And for example, if you have a home that you insure for, let's just say $250,000, and your contents is always the one where people are like, it doesn't cost that much, or, oh, well, we maybe have $20,000 worth. You start looking at what you have in there. Forget about the memories of photos and such, but couch, TV, refrigerator, oh, yep. But I thought the key to me was it just didn't cost that much to insure that much more.
That's right. With your personal property, those contents that are in your home, normally that's a percentage of how much your home is insured for. And if you need to increase that limit, you can. But I'm going to go back to the liability limit and not so much about boats and golf carts, because not everyone has that, but auto liability limits. If whatever limit you choose, that's the limit you have chosen, and that's the limit that the insurance company will pay out in case of an accident. So if you or someone driving your vehicle is at fault in an accident, those are the limits that the insurance company will pay out. And after that, after they pay out what they've agreed to with the contract of the policy, if that's not enough to take care of the other people, they can sue you personally and take whatever assets you have, your home, your audit, your savings. If you don't have any of that, then they can take your future wages. And it may not seem fair, but if you or someone driving your car is at fault in an accident and someone else is going to be in a, rehab or wheelchair.
Sandy, we're coming up on a quick break and have to pay some people here through commercials, but I want you to keep that thought because that is very big, and I want you to elaborate on that when we come right back.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your insurance policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all of your insurance needs 24/7. Now that's good policy. This is Bubba Johnson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Medical Forum, presented by At Your Service Home Care.
And we are back for our last segment. We've got our friends here from Bynum Insurance. And when we left off, Sandy, you're striking a nerve with two men that have kids that are high school kids, and we're talking about cars and insurance and liability and maybe not having enough coverage, Chris.
And
I'm scared.
I think we really should be.
Okay.
And as a physician, I see this on the flip side all the time. I see the results of the motor vehicle accidents. Patients come in, and there are a lot of bills. And there's bills for medical care. There's bills for lost wages. There's bills for medications, physical therapy, whether they're seeing specialists. And their medical insurance is not covering this. So all of these bills are going straight back to the auto insurance. And so these liability limits really need to be at a level to compensate for this. Karen?
That's right. The state of South Carolina, each state has minimum limits that someone must have if they have a license tag on their vehicle. And the minimum limits in South Carolina are, and I'm going to give the most common, how most all insurance companies write their insurance. There's two sections to it. One is for bodily injury, and one is for property damage. So $25,000 for any one person's bodily injury, $50,000 for the all bodily injury for the whole accident. So $25,000 for any one person, $50,000 the max for everyone. And then on the property damage side is $25,000 for property damage. So the state of South Carolina requires that you have those limits, at least those limits. And some people want to take the minimum limits, but it doesn't normally cost that much more to increase the limits. And what I say is that you should get the highest limit that your budget allows. Look at the limits, look at your budget, and get the highest limit that your budget allows. When you think of you're purchasing insurance, it's like you are telling the insurance company, put this much in my checkbook, that if I have a claim, you're going to pay out. If I'm responsible for an accident, you're going to take this checkbook and you're going to use it to pay out. So they have one checkbook for injuries. And like you mentioned, there could be loss of wages or medical bills.
You could start from the minute of the accident. First, you're going to have an ambulance bill. Next, you're going to have an emergency room bill. Then you're probably going to you may have a hospital stay bill or a surgical bill, physician bills, medication bills, physical therapy bills, and then loss of wages. I mean, $25,000 sounds like a lot, but it can be burned through very quickly.
That's exactly right. If when what you just described probably exceeded $25,000, and if not, there may be surgery, there may be rehab, there may be some type of ongoing pain or ongoing, maybe someone isn't going to be able to work at their same profession, and so they're going to have real major loss of wages over a lifetime, or they're going to need a wheelchair. So whatever limits, look at the highest limits you can afford and get those limits. Like I said, to increase from one limit to another normally isn't that expensive. But just remember, after the insurance company pays out whatever limits you have purchased, then if that is not enough for the people who were injured, then they can sue you personally.
Well, let me ask you this. Obviously, the most statistics will tell us that people more apt to get into a wreck are new drivers, teenagers.
That's right.
So a recommendation for anyone out there who has a 16-year-old, a 17-year-old, what would you recommend? And let's just assume that the car is
other than a cab. Other than a cab service.
Yeah. I mean, what would you recommend? Because the other thing that they happen to be toting with them 90% of the time are also very young people. And all the things that you had talked about, Dr. Marr, with those immediate visits, the ambulance and such. If there's a loss of capabilities for this gentleman, an 18-year-old child right now probably has 60 more years that if they are then, their hands are taken away. Their ability to walk, to do labor, those add up. And I know that when attorneys sit around and say, okay, he's not able to do this forever, so we have minimized what his job capabilities are. What would you recommend? I walk into your office, I have a 16-year-old son, and let's just also point out, let's say you kids out there, good grades, that helps parents. Being responsible, not having records. There's a lot of kids who walk in when they shouldn't have had a license even and already have some nicks on them. What would you recommend to a parent coming in to see you today with a 16-year-old? What kind of insurance should they have?
That is a great time to look at your limits again. When any of us can have an accident, any of us can have a mistake, but say you haven't really looked at your limits in a while, but you thought maybe you were a real careful driver and that you really didn't need the higher limits. You're right. When you're adding a child, that's a great time to look at the limits because they are inexperienced and more likely to have an accident than an experienced driver. And, of course, every parent will have their own rules for those children and, how many friends they can have in the car and that type of thing.
And they'll listen 100%.
That's right. I'm sure
they're
will.
Perfect.
I'm sure they will. And as far as when you add a child, good grades and AB average helps quite a bit on a discount. And then if they've had driver's training, that's also an additional discount. And then later on, when maybe they're finishing with high school or getting ready to go to college and they're starting to begin in a few years, they'll have a policy of their own. There's some things you can do so that when they are on their own getting their first policy, they'll have an advantage for getting the best price. And the number one is to keep them on a parent's policy as a driver until they get their own, because that gives them previous insurance, continuous insurance, and that probably helps the most. But also, they can start working on their building good credit. Just like with mortgages and other types of loans, you get better rates when you build the better credit. The same thing is with insurance. And so if they can build a good record.
Sandy, I'll tell you what, because our hour has flown by. And I want to thank both of you for coming in on this. And just a wealth of knowledge. You have to come back and see us again. Before we head out, really quickly, Karen, phone number, contact number for you, direct line?
Sure. The direct line is 803-905-4547, and we're at 1170 Wilson Hall Road.
Sandy, your direct line?
803-905-4520.
I apologize for cutting you off. We have to get off the air and let them work here.
Thank you all for coming today. We really appreciate it.
We will definitely have you back.